At the Busia, Kenya-Uganda border point, people are coming in and out of the country as usual, blatantly turning a blind eye to the risk of contracting the Ebola virus from the neighboring country, Uganda.
Unakuta la kwamba wengine wanatoka Uganda, wengine wanatoka Congo, wengine wanatoka Rwanda.
The risk is increased by rogue boda operators.
Wengine wanapita panya routes. Na wakipita panya routes, hakuna vile wanaweza kupimwa.
Kuna chorochoro mingi za ndani hapa. Navukisha tu mtu, sasa ameshafika Uganda. Na watu wengi hata ukimwambia tupite custom, atakwambia custom mimi sitaki.
The Ministry of Health on its part has conflicting views on the measures taken at the Kenya-Uganda border.
We have heightened our surveillance system, especially at our border points, by screening all travelers coming from Uganda, especially the truck drivers, people who are crossing the border. But you know, the border is also porous.
In Malaba, a convoy of trucks transporting goods is also heading to Uganda. However, according to health officials at the Malaba border station, truck drivers coming from Uganda are required to show a document that proves they are not infected with Ebola. Ugandan citizens who arrive here provide their passports in order to be registered as visitors in Kenya. But there is no proof required to indicate whether or not they are infected with Ebola.
Wenye wanatoka Uganda, sasa hao ndio tuko na hofu nao, tuelewi itakuwa namna gani kwa sababu hizo signs huwezi jua.
Kwa hivyo naomba madaktari wa Kenya wao alert kama imelipuka huko, waone vile wanaweza kungangana na watu wa Kenya ili waweze kuzuia mambo ya ugonjwa Ebola ili isifike hapa hivi.
Acting Director General at the Ministry of Health, Dr. Patrick Amoth, says engagements with stakeholders are currently underway in seeking to improve our preparedness in the event Ebola arrives in the country.
We are doing community sensitization. We are also sensitizing the healthcare workers, especially in the context of infection prevention control, because the transmission of Ebola is from human to human contact.
At the same time, investigations are still ongoing in Uganda to assess whether the deceased infected anyone and whether Ebola has spread further.
Uganda is also following up on 5 suspicious deaths that occurred in the first 2 weeks of September within the same vicinity of Bubende district, including of a healthcare worker. So that will be able to inform us further whether these suspicious deaths are related to Ebola.
The Ministry of Health has asked Kenyans to be on the lookout while interacting with anyone who has traveled from Uganda in the past 3 weeks. Symptoms of Ebola include vomiting, diarrhea, abdominal pains, headache, red eyes, sore throat, measles-like rash, and bleeding from body openings. If you happen to spot these symptoms, you are advised to report by calling 0729 47 1414 or 0732 35 35 35. Ben Kerera, K24, Nairobi.